Welcome to Ask Dr. Mingle, the Q&A series from Mingle Health answering your questions about quality programs and the transition to value-based care. I'm Kyle Breckel. I'm a digital marketing specialist here at Mingle Health, and I'll be hosting this episode along with Dr. Dan Mingle, founder and CEO of Mingle Health. Hi, Dr. Mingle.
Good morning, Kyle, and good day to all of you tuning in. It's great to see you again. I am Dr. Dan Mingle, and I'm here to answer your questions to the best of my ability.
Well, we have two great questions for you today, Dr. Mingle, so if you're ready for them, let's jump in.
Bring them on, Kyle.
Our first question is from Lisa, and Lisa asks, how will ACOs, now responsible for assuring all participants report promoting interoperability, that is PI, be impacted by the actual performance of all participating TINs?
Great question, Lisa. 2025 is the year that the rule goes into effect that all ACO participants are expected to use certified EHR technology, that's CEHRT, or CERT, and to make a promoting interoperability submission. In prior years, 75% of the advanced APM participants and 50% of MIPS APM participants were required to use CERT. Now, there are a couple of caveats into this new requirement. There's a big loophole in the requirement. All of the exceptions that exist for the MIPS promoting interoperability performance category apply to the CERT use requirement in ACOs, including small practices, facility-based practices, and non-patient facing practices. So if they don't need in MIPS to submit promoting interoperability, they don't need in ACOs to be using CERT. Now, the use of CERT is a contractual requirement built now into all ACO contracts with CMS. There's not a scoring requirement, just a submission requirement. Neither the individual scores nor the composite ACO score factors into ACO performance or collection of shared savings. So no scoring effect on the ACO. Now there are some indirect effects, so beware. A couple of my clients have gotten trapped by this. There's one other factor to keep in mind about scoring. Though the ACO will not experience any differential payment based on the promoting interoperability score, that is not true of the participating TIN practices or the participating NPI providers. That's TIN is tax ID number practices. That's how Medicare identifies individual practices, or NPI providers. Again, that's how Medicare recognizes individual providers. Those practices and providers that are MIPS liable will have a MIPS adjustment to which the promoting interoperability score is important. Even though promoting interoperability score will not affect ACO collection of shared savings, it will affect the MIPS adjustment of Medicare payments to practices and providers. Now, the ACO might be collecting that for all of their practices and providers, so it may affect ACO payments. But again, it's not a direct effect on the ACOs; it's an effect on the practices and providers. In a MIPS APM, every practice and provider in a MIPS APM will have a MIPS adjustment. In an advanced APM, every provider in an advanced APM that doesn't achieve qualified participant status will have payments affected by the MIPS adjustment, to which the PI score applies. So I hope that answers your question, Lisa. Be careful. The same performance category and submission count for both, but they're treated differently on the MIPS liable providers in your organization and the ACO itself.
Thank you for the great question, Lisa. And our final question for you today, Dr. Mingle, is from Jamie. And Jamie asks, when can a practice file for an exception to the cost performance category?
Great question, Jamie. You're referring to an extreme and unusual circumstances. That's an EUC application relating to MIPS scoring issues. Technically, any or all elements of MIPS scoring are subject to EUC exceptions. The application window for a performance year typically opens in April of each performance year and closes when the calendar year ends, though there are occasionally special circumstances that extend the application window. That said, the cost performance category is not typically something that is waived. Now, not everyone is scored on costs. There are two automatic exceptions for cost measures. First is case minimums. In a traditional MIP submission, a provider practice will be scored on every cost measure for which they have case minimums for the measure. For MVPs, that is the MIPS value pathways, a provider practice will be scored on all of the cost measures included in the MVP, only the cost measures included in the MVP, and only those for which they have case minimums for the measure. The most common case minimum is 20 cases, but there are exceptions to that. The second exception to cost measurement is APM participation. Part of every alternative payment model contract is a differential payment based on the cost of care. Because cost is a factor in payment, APM participants who are subject to MIPS adjustments are automatically accepted from cost scoring. Now, though I've not seen the cost category accepted through the EUC, that's the exceptional unusual circumstances process for any practice or provider, I can imagine a compelling argument in an EUC application that could win an exception. So if you believe such a circumstance exists for you, make an application. Application is available on the qpp.cms.gov website. Watch on the website for the opening of the application window. It typically occurs every April, sometime between the 1st and the 30th. So keep your eye on it and make application as soon as you can. I do find that Medicare responds quickly to applications, makes a judgment, and gets it out. So the sooner you get it in, the sooner you'll know whether you are forgiven from cost or not.
Great question, Jamie. Thank you for sending it in, and thank you to Lisa as well, and thank you, Dr. Mingle, for sharing your insight with us today.
Thank you, Kyle, and thanks to all of you for your great questions. I want to be helpful. I want this to be useful to you. Don't hesitate to correct me or supplement my answers. Share your experience, ask your questions. We can be smarter together.